Again, good morning, everybody. I want to thank all the presenters yesterday. It was really a fantastic series of presentations. I'm looking forward to further discussions today. I think we brought a lot of issues forward, a lot of food for thought on how we move forward on modeling the health risks of climate change. And I'm going to take my few minutes this morning to provide some reflections about where we are in the field and some areas where I think we need to move forward, and provide a very short introduction to Tony Janaitis' talk. So what I heard yesterday were a series of just outstanding presentations about different kinds of models. And the people here are some of the best modelers there are on the health risks of climate change. Across the field, we have quite a diversity of people who model. And one of the challenges I see is that people often don't give the question they're trying to answer. It's like Jeopardy, we've got lots of answers, so people get up and talk about the model, but they don't say why they're modeling. And there seems to be kind of broad confusion in the health sector about models, why we model, and the fact that we've got different purposes and we need different models. We heard a lot about exposure-response relationships. There's some very good presentations on that. This is nurse advice calls from Gothenburg, just showing that the nurse advice calls, predominantly for diarrheal diseases, go up when it rains. Gets to the issue we talked about yesterday of what happens when you have heavy precipitation events, having pathogens wash into waterways. We had a lot of presentations about what will happen if you take those exposure-response relationships and look into the future and what the future might bring. Had discussions around early warning systems. I really like this. This comes from a Swedish newspaper, and when I look at that face, I don't think about heat, actually. I'm not sure what moved them to put that as the face for we've got a heat wave, but I'm missing something culturally. Maybe Jan can explain it. We did hear a lot about early warning systems. We heard a little bit about prices, cost benefits, how we're going to look at what the price tags will be associated with dealing with current climate variability and long-term climate change. We talked a bit about communications. I think this is the most succinct summary I've seen of the Working Group 2 report. Tony, you're not paying attention. And this leads to a lot of confusion. This is the day that Sweden switched from driving on the left side to driving on the right side of the road. And what I hear is a lot of confusion, that people talk about their early warning systems, and some people will ask, well, what does that mean in a changing climate? Well, an early warning system isn't designed to talk about what's going to happen in a changing climate. Someone will say, I've got projections for 2050, and a question will be basically around what does that mean for next month, next year? It's not the right scale. And there's a phrase that's used fairly commonly outside of the health sector called horses for courses. Different models have different purposes. And the health sector needs a wide diversity of models to achieve a wide diversity of purposes. And it will really help if we're much clearer in our communications within and outside the sector, if we talk about what we're modeling for, what are our goals, what are we trying to achieve. One thing that's impressed me quite a lot in my interactions with the integrated assessment modeling community is in meetings with them, someone will say, here's a policy question we have to answer. And immediately, all the members of the community will say, well, this is the right model to answer that question. That this is the model that has the information in it that will help you answer that policy question. We've got a long way to go in this community to get there, to be able to say we do have a whole suite of models to answer questions. And you need that for a range of reasons. An important one is we don't know what the future is going to look like. Different models have different sets of assumptions, and as we move forward, we're going to have a variety of models with a variety of assumptions to help address the questions that policymakers are going to come at us with. We're going to be asked to answer these, we better have models to do it. A couple of issues that were just briefly touched on yesterday. One was moving beyond our data. It has been incredibly challenging to get the community to start thinking about how we move beyond our data. There must be at least 10,000 publications on low-dose extrapolation. It's a well-developed field of what happens. We're concerned about a particular exposure. When we set regulations, we try to reduce that exposure, and what kind of assumptions do we make as we move towards no exposure to that and hopefully no response? What is that shape of the curve down at the lower end? But there just aren't publications at the upper end. We're moving beyond our data. We're moving to new weather patterns. We don't understand what might happen physiologically. We're having heat waves that are so far beyond anybody's experience. How do you think about the exposure-response relationship? So this is from, finally convinced Joachim Rockloff, a really good statistician, to take a look at this, and it's a publication that he and I put together for Stockholm, looking at heat effects, but it's trying to open up this whole area of how do we think about that. And saying we don't have data isn't going to help. As you look across all the sectors, we don't have data for a lot of things. What kinds of assumptions do we make? Why do we make those assumptions, and how can we justify them? And this should be a field of inquiry to help inform how we develop models for future risks. The other thing we heard a little bit about, but not much yesterday, was thresholds. This, again, is some work that was done in Sweden. It's looking at the dengue epidemic potential. And the point is, if you look at the top and the bottom, these are differences in that potential, basically today versus early 1900s, and then projected out to the end of the century. Very clearly, thresholds are going to be crossed. We have such limited understanding of those thresholds. And we're going to cross them. The question is whether we're going to have any idea that we're going to be crossing them, or are we only going to wait and see what happens after we do? And to start really thinking about where those thresholds might be, what experiments do we need to do in the laboratories, what do we need to do with our models, can we test them in different ways, looking at different kinds of parameters, how can we get to those thresholds to identify ways to intervene before we have lots of cases. What we're doing is we're modeling for insights. It's another area of confusion that I see in the health sector. No one who actually models out past an early warning system truly believes their results. You're modeling for insights. You're trying to understand how systems work. You're trying to understand what would happen under a particular set of conditions. We need to be more explicit that these are Bayesian experiments. We're setting up a series of priors, and then we're seeing what happens. And we're gaining insights from that to help inform what we do, how we go about things, what needs to be done in terms of policies, what needs to be done in terms of budgets, a whole range of issues. But we should be very clear that these are insights, and don't take those numbers home. Nobody is really going to be confident that those numbers have a lot of value, particularly out a couple decades. Another thing I heard about a lot yesterday was how very complicated health systems are and how complicated disease transmission patterns are. If you listen to the AgMIP presentation, Josh did just a terrific job. Everything's complicated. The question is what you do with that. The fact that it's complicated is a given. We're trying to look at systems and how systems work. Okay, so it's complicated. How do you use your modeling to decide what's important? What are the key levers that we're going to have to focus on that could make adjustments to the system? What's going to drive particular outcomes? So the complexity is not in and of itself remarkable. You expect complexity. It's how we manage, how we look at that complexity in terms of how we model. And we're never going to have enough data. I found this, Peter. I wanted to put this in. So we're never going to have enough data. But where is it important? This map is from the 1600s. If I want to fly from Seattle on a float plane up to Vancouver, I'd really like if they would complete the left-hand side of that map. But, you know, for Nick and the work he's doing on Lyme disease, you know, maybe not so much. It might be okay to have the data he's got. You know, Vancouver, yeah. What's important? Where is it missing? Where do we need to fill it in? And it would be nice to have the funding to have very comprehensive data collection. We don't have that right now. We have to be strategic in how we focus on what we need for data. The other point I'd like to make is this is driving the health sector even further from what's been predominantly a medical model view of the world. We look at for the reason something happens. Right? And it's not the reason when you look at a system. Systems do have complexities to them. So an example I'll take that's in the newspaper a lot these days is Ebola. The medical model view and what was published in the newspapers quite extensively is this is the virus that causes Ebola, the disease. It is necessary, but it's not sufficient. You have to be exposed. Once the first case occurs, particularly in the regions of Africa that are of concern right now, there's cultural practices, there's social beliefs, there's a lack of public health infrastructure. In some regions, there's been years of war. There's a whole series of reasons why Ebola is the problem it is. And focusing only on the medical aspect, we're missing much of what's important, particularly from the ability to use models to inform us for how we could be better in the future, and to move beyond this just medical framing into a more substantive, nuanced approach to the problems that we're facing. And so from that, those are my personal perspectives. I want to move into why do we want to look at integrated impacts? I'll use dengue again as an example. This is the official WHO. This is where you see dengue. Except over here, Japan had quite a big outbreak of dengue this year. Quite a lot of controls were put in place in Tokyo to make sure that it didn't spread further than what it already did. Cases of dengue occur in California. There's a whole range of places we know that dengue occurs. Dengue loves humans. It lives around humans. It will find places to breed around humans. There was a very large outbreak recently of dengue in Singapore, one in a string of large outbreaks in Singapore, and it took a very long time. Singapore's got the best control program in the world, and they couldn't figure out where this outbreak was coming from. In Singapore, the Ministry of Health is allowed to go into your house and check to make sure that you've cleaned up all the breeding sites. So they can come in and you're fined if you don't clean up your breeding sites. They couldn't figure out where this was coming from. It's hard to see, but see these clotheslines? They're standpipes, and at the very end of the standpipe, water was collecting, and Aedes was breeding in the water at the end of the standpipe. We also know we see Aedes in places where it shouldn't be because it likes to overwinter in sewers. They're warm, they're moist, they're great places to live. Aedes is transported around the world in used tires. And as we look at what might happen with dengue, we've got growing sophistication and models that are looking at various weather parameters. We're not looking at urbanization, and yet we know it's important. We need to look at different assumptions about what urbanization is going to look like. If there's more unplanned urbanizations, we're just creating more breeding sites. And so how you think about those socioeconomic development factors as they relate to urbanization will be important. And so when we look at our models to think about what kinds of complexities we should be bringing in. And as several people mentioned yesterday, we don't need to apologize. We are where we are. Our models are fairly rudimentary. So we start out with where we are. We add how we can. The models in other sectors are much more complex, but they've got decades of working on those models. They've also had funding that this sector really hasn't had the privilege of having. And eventually we will get those models much more complicated and provide models that will tell us, under a range of possible assumptions, what could happen. Another example I want to use is Shari did a lovely job talking about the quantitative risk assessment, and one of the big issues is around undernutrition. She did a great job laying out the assumptions of those models and what they used. And wouldn't it be nice if we could take the kinds of models that she was working on and connect it with what we heard from AgMIP? And wouldn't it be great if we could take AgMIP and connect it to some of the water sector models? So we can say not just what happens for undernutrition, but we can get to the broader questions. What policymakers are asking for is they don't want to hear from our sector, here's what we estimate for heat, here's what we estimate for diarrheal disease, da 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 da. They want to know what's going to happen in a broad sense. So what's going to happen in parts of sub-Saharan Africa as water resources decline, as temperatures go up, as crop yields fall? Diarrheal diseases will go up because people use water differently when they have less water. Undernutrition is going to go up. Can we pull all that together and model it and give a sense of what the magnitude of that impact might be? That the policymakers are looking for much more understanding at that kind of scale instead of what we're providing at the moment. And as I said, we're providing health outcome by health outcome, region by region, country by country. But can we get a broader scale picture of what this means in the context of other changes as well? I mentioned dengue and urbanization. What are we going to say about the challenges of providing safe water, improved sanitation in a world that has much more unplanned urbanization? Achieving those sustainable development goals are going to be even more difficult. And to come to a place where we can provide these insights at a much broader scale. And then finally, nobody mentioned anything about this so far, and I would like to personally acknowledge the huge debt that our field owes to Tony McMichael, that we wouldn't be where we are as a field without Tony's insights, without his understanding. And it was a shock to everyone when Tony passed away in September. And besides his scientific achievements, we'll all miss his friendship, his humor, his humbleness, and his mentorship. Thank you. And I left myself 2 minutes and 35 seconds for questions. In which case, I'll give those 2 minutes to Tony. Are you ready, Tony?
I'm ready.
Ready, great. Tony Janatos.